Good afternoon, everybody, and thank you again for joining us for another one of our MAG-free specialist education seminars. It's lovely to have you with us. Today, we have Rod Diamond. Rod is a sport and exercise physiologist, sorry, and he's actually come to this role from a previous career as a professional athlete, a football player. So he really walks the walk and talks the talk. He knows what he's talking about. Obviously, he's going to elaborate more in his presentation today, but the concept of sports physiology is that these people who are experts who look at the design of exercise programs, the design of sports programs, that includes rehab, health and fitness, including things like gyms, gym equipment, and the way gym trainers and instructors interact with people who may be trying to build their fitness, build their muscles, train for a particular type of sport or activity, or recover from injury. So it's a very interesting and complex specialty. Very much involved, sadly, in the medico-legal field lately. And from this presentation, you'll see some of those examples. May I ask you could please remain on mute throughout the presentation so that noise from your home or office does not interrupt the quality of the recording. At the end of the session, there will absolutely be an opportunity for you to ask questions. But if for some reason you have to go before it's finished or you're not comfortable speaking out, you can always type your questions into the chat function and I'll make sure that the questions get read out for Rod to answer. Now, the recording will be sent to you usually within a day or so, so probably Monday, including and as well the slides, but you can always watch this again on our YouTube channel where you can also access all of our other free educational seminars. So once again, thank you for making time to join us today. Thank you very much, Rod, and over to you.
Thanks, Michelle. Hi, so as Michelle alluded to, my name is Rod Diamond and I'm an exercise physiologist. I'm going to initially explain what an exercise physiologist is and the role we play. So we're degree qualified and we assess, design and supervise exercise rehab programs for healthy people and people with obviously complex medical conditions as well. You can see there some of the medical conditions from muscle strains right through to cardiovascular disease, multiple sclerosis, strokes, cancer, etc. We, as exercise physiologists, we are not qualified to diagnose. That's more for the doctor or someone else. Just a little bit about myself. I've been a treating accredited exercise physiologist since 2006. I did my degree here in Sydney at Sydney Uni, and I worked from my rooms at Eastern Suburbs Sports Medicine Centre in Bondi Junction. There I conduct in-person consultations and also conduct telehealth consultations. You can see a list of some additional qualifications of mine: sports massage, strength and conditioning, Olympic weightlifting, and a rugby league coach. And I'm also accredited with Medicare, CIRA, iCare, Department of Veteran Affairs, and NDIS. I have over 40 years experience in the world of health and fitness, sport, strength and conditioning, physical activity. I treat private patients and persons under those government schemes such as NDIS, DVA and iCare. Part of my role is to help fit out gymnasiums for hotels, schools, sporting teams, rehab clinics. I do a lot of work in the space of Aboriginal and Torres Strait Islander health. As Michelle alluded to, I played sport, rugby league for 10 years, and part of my role now is to mentor a lot of athletes transitioning into life after sport. And also I help some athletes studying various courses such as health and fitness or sports science degrees. My current research is heavily involved in stem cells. I had a stem cell paper that I was a co-author of, published in 2015. And I also authored a weightlifting paper in 2003. I've been providing expert witness reports since 2012 for both plaintiff and defendants. So my talk today is going to be about the three areas that the reports that I've been providing cover. So professional rehab or medical negligence, gymnasiums and trainers, and sports injuries. So the first area would be personal injury from the medical negligence, or what I'd consider more to be professional negligence in the space of the medical world. So the personal injury in this area could originate from, as the following says there, surgeons, doctors, physios, massage therapists, rehab providers. The area that I deal with mostly is the physios, the massage therapists, occupational therapists, staff within hospitals and rehab clinics. The surgeons and the doctors I don't get involved with at all. So negligence could arise in any of these following areas, either when the medical practitioner assesses the patient, or they commence treating the patient, or they design an exercise program and the exercise program may not be suitable or appropriate for the patient. The rehab providers area usually work in the workers' compensation and motor vehicle accident areas, and they act independently from the insurance companies in an attempt to get the person back to work. So in these rehab providers space, it's usually during the functional capacity assessment that's being conducted by an occupational therapist is where the negligence usually occurs. And this could be for reasons such as aggravating an existing injury, not thoroughly assessing the person correctly, alternatively, even with regards to the assessment could even aggravate or incur another injury from a different body part as well. Or, excuse me a moment. So my role in the professional medical negligence area is I've done reports, costings for a rehab program, reviewing the exercise rehab program designed by a treatment provider, reviewing massage techniques by a massage therapist, or reviewing a functional capacity assessment. And just a few matters that I've been involved in that might make it a bit easier. So I was involved in a matter where a rehab hospital provided inappropriate and unsuitable exercises for the plaintiff after an operation. So I then provided a report for the lawyers acting for the plaintiff that included explaining why the exercises provided were inappropriate and then having to suggest suitable exercises and a suitable exercise rehab program. Another matter I was involved with was a costings report for the plaintiff where the person was injured whilst undergoing surgery. So in this particular matter, I provided a report for the lawyers, again acting for the plaintiff, that included a functional capacity assessment for the injured person or for the plaintiff, which looked at, for instance, their tolerances, what they can and can't do from a exercise or physical activity perspective, the possible risk of cardiovascular disease as the injured person can no longer exercise as they once used to, and then future costings for rehabilitation and treatment. A further matter I was involved with where a person was incorrectly assessed by a return to work rehab provider. So this area, I provided a report for the lawyers, again acting for the injured person in this case, that included why the assessment was incorrect. And then I conducted a functional capacity assessment with questionnaires and looking at the worker's occupation for a return to work. Another matter where a physiotherapist provided an incorrect exercise regime for the plaintiff. So we provided a report for the lawyers acting for the plaintiff, including, again, conducting an assessment, outlining what exercises and why the exercises were unsuitable, and then made some suggestions on suitable and appropriate exercises for the injured person. And a final matter I was involved in this area would be where a massage therapist provided incorrect massage techniques, injuring the plaintiff. So in this particular matter, again, providing a report for the lawyers acting for the plaintiff that included, was a consent form completed? I then conducted an assessment on the injured person, looking at outlining the techniques used by the massage therapist, the injuries concerned as a result of these techniques, and what a suitable approach and techniques ought to have been provided by the massage therapist. So there's just a few examples of that professional negligence, medical negligence space that I work in. The documents that I require from lawyers would be the following: clinical notes from the hospital and healthcare professionals, possible CCTV footage if required, documentation from the insurance company if it's a workers' comp or motor vehicle accident claim, and clinical notes from the rehab provider. So in all my matters, irrespective of what it may be, we use the following protocols. And this is important because this gives the lawyer and myself an understanding of where we're at with the matter. So I initially review all the medical and legal documents that are provided. I then like to have a teleconference with the lawyer to ensure that we're all on the same page. I'm the correct person providing the report, and we do have a good, strong case. I would then request a Zoom meeting with the client, whether it be the plaintiff or the defendant, to find out a bit more about the matter and ask some more specific questions that may be relevant. I would then commence the report. And one area that's just come to our attention earlier this year, actually in February, was the Supreme Court giving the general practice notice regarding AI. So in that particular area, we have a standalone paragraph saying that we confirm that generative artificial intelligence has not been used to generate any content within this report. This seems to be quite a stringent area now that we're all affected by. And I would say, on average, I would probably reject about a quarter of the inquiries that I receive. Usually they're outside my area of expertise, and I'm happy to talk about them, but I won't touch them. That's it for the professional negligence area. We'll now go on and talk about injuries sustained exercising either in the gymnasium or outdoors. And this could be either exercising alone or under the supervision of a trainer. So in the gymnasium area, it could be a commercial gym, a school or a university gym, a sporting club, PCYC. And for the trainers, it could be a boxing trainer, personal trainer, a Pilates, or even a yoga instructor. So the responsibilities and roles of the gymnasium, we'll talk about that first. The gymnasium has a huge responsibility to ensure that the layout of the gym is suitable, it's safe, it's clean, there's good lighting, the wet areas are sufficient. They either employ or contract appropriate qualified persons to either run the gym or work on the gym floor. The appropriate staff can offer assistance and guidance to persons exercising if they wish to. The next role and responsibility of the gymnasium is to ensure that all the exercise equipment is checked daily to ensure that it's all in good, safe working order. We then ask questions about when was the equipment purchased, where was it purchased from, how often is it maintained, and whom by. Another responsibility of the gym is to ensure that all the equipment has instructional stickers or a QR code provided by the manufacturer, located on the equipment that it's easily visible and understood. And another question we would ask, if the gym equipment isn't working, what is the gymnasium's policy? A lot of gymnasiums have equipment that may be 5 or 10 years old, possibly out of warranty. And then also the maintenance of the equipment. A lot of the commercial gyms would have their own maintenance persons employed. Otherwise, maintenance people from the exercise equipment manufacturer may come and maintain the equipment for them. In gymnasiums, some of the areas that you can be injured from is that the equipment is not in good, safe working order. There are no instructions or poor instructions provided on how to use it. The gymnasium is not neat, clean and tidy, possibly poor lighting, or possibly poor or even no supervision. The next slide will show you what I mean about not neat, clean and tidy. It's fairly straightforward. With all the equipment there, you can see on the floor, which should be up on some type of storage area. We'll now talk about the personal trainers in the gymnasium. There's 3 qualifications. There's a Certificate 3, Certificate 4, or a group exercise trainer. Each level of qualification allows the person to do a little bit more responsibility. They are usually and ought to be registered with AusActive, which is the governing body for trainers in gymnasiums in Australia, and then they become insured after that. Additional qualifications for the trainers could be a diploma in health and fitness, or possibly a degree in human movements, sport science. Additional trainers qualifications. So you may have a personal trainer, but then you may want to go and teach boxing, kettlebells, Pilates or yoga. So you have to have additional qualifications to be able to teach those types of exercises. Again, if you're going to be training outdoors, you also need local council requirements and permits. And there's obviously additional insurances involved with wanting to conduct, firstly, outdoor exercises, and secondly, in those 4 particular areas. And a huge responsibility for the trainer is to ensure that all their persons they are looking after complete a pre-exercise questionnaire. We find that this doesn't happen often enough. The questionnaire identifies if the person has any medical conditions, which could be untoward towards exercising. If they do have something untoward, we would encourage the trainer to refer the person back to their GP for a referral and a medical clearance prior to supervising any type of exercises. Once that document has been completed, the trainer ought to then conduct a physical assessment on the person to obtain baseline data, such as heart rate, blood pressure, strength, cardiovascular fitness. Once that's completed, the trainer then ought to then design an exercise program using obviously safe, suitable, and appropriate exercises. So injuries from trainers, some of the reasons are failure to assess the person correctly, overtraining the person, so the person may not be conditioned to do the exercise regime that's been designed for them, failure to inspect the indoor or outdoor areas, poor supervision, and the trainer themselves training persons who are outside the trainer's area of expertise. So a Cert 4 trainer would not really be suitable to train someone with cancer or heart conditions or the like. So we'll look at some negligence from the exercise equipment perspective. And in this area, we look to ask, is the piece of equipment we are talking about the exact same piece of equipment that was used when the person was injured? So if a lawyer came to me and said the person was using a machine in the gym, we've got to ensure it's the exact same piece of equipment that we're looking at. It can't be a variation or a new model or anything like that. It's got to be the same, like for like. So then we ask the question, was the cause of the injury an accident or was it negligence? Now that comes into effect whereby, as I said earlier, every piece of equipment ought to be checked on a daily basis. If it is, and then something happened to the piece of equipment at 3 o'clock in the afternoon, we then have to determine, is it bad luck or is it negligence on the gymnasium's behalf? So we then look at, for instance, could the person have been instructed to perform or performed on their own a different, similar, or a variation of the exercises using different exercise equipment, which would have reduced the risk of harm? For instance, instead of using a Swiss ball, could the person have used a bench, which is obviously a lot safer, a lot more stable, and reducing the risk of harm of a Swiss ball not bursting or rolling? So they're the kind of questions that I would go through with the lawyer initially to make sure we have a strong case if we're doing a matter. So current and emerging trends in the gymnasium and personal training world. So wearable devices such as an Aura ring, persons using heart rate monitors, recovery studios that have infrared saunas, steam rooms, saunas, ice baths. A lot of gyms are now having wellbeing and quiet space areas. So they're really talking about the recovery area and the recovery space within a gym. The counter argument to that is you've got to train and exercise before you recover. So a lot of people go in there and think it's a big social scene rather than using it for a physiological or a mental health area. Another big area of emerging trends is obviously AI, online apps for training. However, they're not being supervised and there's obviously risks involved in that. The same with 24-hour gymnasiums that are unstaffed during certain hours. There was a matter in 2023 where a gentleman was in the shower of a unsupervised 24-hour gymnasium. He collapsed in the gym. He was not able to access the emergency button. Unfortunately, he was found, I believe it was 7 or 8 hours later, unfortunately passed away. So these 24-hour gyms sound wonderful, but there are obviously risks involved in there. A lot of gymnasiums now are also putting signs up saying no taking of photos or no filming yourself. They become a trip hazard. There are safety reasons and obviously a distraction for a lot of other people trying to use the space in the gym. Another emerging trend is QR codes now we find on exercise machines, whereby you scan your phone over the QR code and it will give you a 20 or 30-second instructional video on how to use the piece of exercise equipment. My role in this area is to provide a report acting for the defendant or the plaintiff, which may include the following. Was the gym suitably appointed? Was it safe? Was the exercise equipment in safe working order? Were the trainers qualified, etc.? I was involved in a few matters, 2 defendant matters. The first one, I provided a report for the lawyers acting for the defendant, where the defendant tried to sue the gym for using, in his words, a faulty piece of exercise equipment. So in that particular matter, I conducted a site inspection of the gym. It was like-for-like piece of equipment. We took some videos and photos of myself using the equipment and then providing a report for the lawyers acting for the defendant in that matter. Another defendant matter I was involved in was a matter where the injured person tried to sue a boxing trainer whilst participating in a boxing exercise class. So in that particular matter, providing a report for the lawyers acting for the defendant, we looked at, for instance, the plaintiff's history of sport. Did she have any pre-existing medical conditions? What was she doing at the time of the injury, alleged injury? And what did the plaintiff do after the alleged injury? Because that can say whether or not, for instance, I hurt my knee, but then she's able to walk 100 yards to her car. A couple of matters I was involved in acting for the lawyers who were acting for the plaintiff, a matter where the person was injured performing Pilates, or a person suffering from heat exhaustion whilst performing exercises under the supervision of a trainer, or a person injured whilst using a piece of exercise equipment did not have clear instructions on how to use the equipment. So in all those 3 matters, I provided a report for the lawyers acting for the plaintiff. And the second one, the heat exhaustion one, was quite intense, where a person was going for a run under the supervision of a trainer and collapsed due to heat exhaustion. The final matter there, again, providing a report for the lawyers acting for the plaintiff. We did a site inspection of the gymnasium. We watched some CCTV footage of the incident. We then used the piece of exercise equipment, compared this old piece of exercise equipment to newer models, and we raised the question of why didn't the gymnasium update their exercise equipment? And examples of documents that I'd require, again, very similar to the previous matters: incident reports, CCTV footage, clinical notes, witness statements if available, images of the exact piece of exercise equipment, the logbook to indicate all the equipment's been checked on a daily basis, the maintenance logbook, qualifications and insurances of the trainer, and any pre-existing injuries of the injured person. So that concludes that component of the talk. The final component is going to be injuries sustained whilst playing sport. So in this particular area, the questions I'd be asking would be, what type of injury is it? Was it a collision injury or not? What sport was being played? Where did the injury occur? And when did the injury occur? Was it outdoors on a playing field? Was it indoors on a wooden floor? Was it a game? Was it training? Those types of questions, the type of surface that they're playing on, and what time did the injury occur? We have sports ground requirements for outdoor sports. So initially there'd be a hires agreement between the council-owned sports ground and the sports association. And then we've got to ensure that the ground is in safe, fit for purpose condition. An example would be the council hands the ground over to the sporting association at 8 o'clock in the morning, but the first game may not be till 9 o'clock, and the officials may not arrive until 8:30. So between 8 and 8:30, you could be walking your dog there, and the dog could dig up potholes on the ground and cause all sorts of problems. So we've got to look to make sure that the ground is safe. And could it be the council's fault, or could it be the sports association's fault for not providing a safe ground? Lighting requirements, we look at standards such as floodlight requirements for participating in sport. So lux is the intensity of the light. And most sporting codes have their own standards for floodlighting. The things to consider we look at is the team professional or amateur? Is the team a junior or a senior representative team? Is the team training or playing? And is the game being broadcast either on TV or being streamed? That will then determine the lux of the lighting. Current trends in the athletes. Wearables such as watches, heart rate monitors, sleep monitors, GPS devices, providing real-time information back to the trainers. There are things now, healthy lifestyle apps called an athlete management system that all athletes complete on a daily basis. That's usually at a professional level, whether it be professional sport in Australia or representing your state or your country. That seems to be quite common practice now. That gives the trainers daily measurements of each particular athlete. Areas such as use of drones when training by the clubs or the teams, and also there could be overtraining. So this is where the healthy lifestyle app comes into play for the trainer to ensure they're not overtraining any of the athletes. Another area in the emerging trends is called brain eye, or various devices that look at the altered state of mind of athletes, possible head injuries, concussion, and the like. So the current trends for recovery. In the medical world, we're using treatments such as shockwave therapy, blood plasma, and stem cell therapy. And there's obviously continuing research we're doing in the stem cell world at the moment. In the general world for recovery, there are areas such as we touched on before, recovery studios that have ice baths, infrared saunas. There's also compression garments, and salt baths and cryotherapy seems to be quite popular as well. The area that's probably most relevant to the lawyers in the current trend is class actions by athletes. And we're all aware of these. In England at the moment, there's a couple of different class actions on brain injuries, and these links here that you can look at yourself in your own time are just some newspaper articles over the last 12 or 18 months explaining what those class actions are. If I'm able to pull up just this one here, if it does open. And that was in 2022, so 3 years ago now. About 75 ex-rugby league players are set to launch a legal action. That's all going through at the moment. Some players that I played against and with are involved in those class actions, so I won't talk any more about those. The emerging trends in technology and devices. So as I spoke about before, wearables and all those types of technologies that give measurements, biomechanical analysis programs such as Dartfish, and if anyone watched the cricket in the summer, Fox Sports had on their test match coverage, they turned the athlete into a stick figure and put little dots on the athlete, their chest, their shoulder, their head, their knee, to look at the angles of the various joints. So all that type of content is now coming. It originates from the medical world in biomechanical analysis. We look at also various software programs that look at athletes during a game of sport. Tennis is probably the best example, where we look at, did the tennis player hit X number of forehands, X number of backhands? Did they serve out wide? Did they serve down the middle of the line? And that helps their trainer and themselves to formulate a game plan for their next match. The head injury device I touched on earlier, called Brain Health, which detects an altered state of mind, that is currently what we call an indicative tool. It's not a diagnostic tool. There are a couple on the market that are diagnostic, and we're testing those at the moment to see how relevant they really are. The next area is the most recent emerging trends we find in the sports world are two: transgender athletes and climate change. And again, there's a couple of links there, one to the Australian Golf article that was, I believe it was in January this year, that the Golf Australia brought out a ruling that they are banning Australian women transgender golfers. So that was, sorry, in December, 6 months ago. That article you can read. And the other concern is climate change. Climate change is important. We look at how do we prepare a ground, for instance, out in Dubbo or Orange or the middle of Australia where there's drought. Is the ground going to be suitable to be playing a game of sport on? Then we look at, for instance, playing conditions. So most sports now have a weather policy, whether it be a hot weather or a cold weather policy. So a heat policy, training outdoors and playing outdoors, such as cricket and tennis. Then we have a wet weather policy, so for hail and thunder and obviously the winter sports. And then we look at how do we then manage that and how do we balance that out? So a lot of sports will introduce, for instance, shorter game time, so quarters instead of halves, maybe playing the game in the evening instead of during the day, extra drink breaks during the game to counter that hot weather. And some games can get called off if the weather is too hot. All these are obviously risk of harm to the athlete. And remembering all these athletes are potential customers or clients of the lawyer as well. I've just chosen 4 quick sports here to look at the emerging trends in them. In soccer, in England, they've introduced a no heading policy for players under the age of, I believe it's 12 years of age. So reducing the amount of heading of the ball the players are allowed to do during training. And then another area is changing the material of the ball used at training. So the first point of no heading at all, that's a blanket coverage. However, in the senior grade, so from 14, 15 onwards, reducing the amount of heading the ball and obviously changing the material from the synthetic to maybe something else. The counter argument to that was that Dr. Peake from Sports Medicine Australia said, well, if we're not teaching kids until the age of 12 or 13 how to hit a ball, what's that going to be like when they learn how to land properly in technique? That could pose other problems such as other injuries to other body parts. And again, there's 2 articles there that you can read yourself to familiarise yourself. Rugby union, in 2024, rugby union implemented a trial in all domestic competitions in Australia, and I believe now worldwide, that saw the legal height of tackles to become below the sternum. And again, there's 3 articles there that you can read yourself regarding the tackling technique and this new rule that they brought in. In cricket, the 2 big trends are bowlers are now only allowed to bowl a limited number of balls per training session to reduce their workload, to reduce their risk of injury, and all batters must wear a helmet with a front fixed grille and an attached stern guard connected to the base of the helmet at the back of the helmet. This was brought in when, unfortunately, Phil Hughes passed away 10 years ago, when he faced the ball, turned his head, and the ball hit him at the back of the head. Unfortunately, he passed away. So those 2 areas of cricket now standard. What the bowlers do now is they bowl their limited balls per training session, and then what the teams have are called net bowlers, where they'll get other players from other grades or other teams or other counties to come and bowl to a touring side, for instance. So the touring side's bowlers can then rest up a little bit. And my sport, rugby league, I think we all know enough about what's going on there in rule changes and head injuries and what have you. The kickoff, that's still being discussed as a possible rule change for next year. But what rugby league clubs are now doing, they're becoming a lot more proactive. So we're now video recording all the training sessions, measuring intensity, heart rate levels of all the players. And we're also monitoring all the weather conditions, both during training and obviously before training, to make sure it's suitable for the athletes to train in those weather conditions. There are 3 videos there that you can watch on your own of head injuries. There's also a TV series on ABC called Plum some you may know about. It's on iView, that talks about an ex-retired player, rugby league player, who lives with CTE. Sorry, not CTE, with head concussion and mental health problems. And there was also in 2020, in November, a young 20-year-old rugby league player playing for Manly, unfortunately passed away due to exertional heat stroke whilst cooling down after the first pre-season training session. That was done up at the Sydney Academy of Sport at Narrabeen, and I've got a copy there of the Coroner's Court inquest that was done last year regarding that particular athlete. So my role to provide a report would be asking those types of questions. What sport was being played? Was the athlete overtrained? What surface or what lighting was provided? Were the players registered to play? And was the game being refereed appropriately by a qualified person? So obviously the amateur level. And does the sport have a wet weather or a heat weather policy for training and playing? The documents I require, again, very similar: incident reports, video footage, clinical notes, possible witness statements, training program on the day if it happened at training, qualifications of the medical staff, the coaches, the referees. Was there a hires agreement between the Sports Association and the council? And then obviously pre-existing injuries of some injured persons. The next slide I'm going to provide is a bit of self-indulgence. That's my team, the new one, the Redcliffe Dolphins, or as we call them, just the Dolphins. And the two famous words now we all say, fins up. So that's my old club, and I'm involved with them as well. Just to finish off with, there's just a couple of matters I was involved with regarding sport. The first one was an athlete falling into a pothole on a playing field. So that comes back to who conducted an inspection on the ground prior to the game being played. Was it the council? So was it the council's fault, or was it the Sports Association? Therefore, was the Sports Association negligent in not inspecting the ground prior to the game being played? The next matter I was involved in was a player colliding with another player on a dimly lit sports field whilst training for a game of sport. This was a young boy training to play sport. He was training on a very, very dimly lit sports field in, it was around about February. They did a training drill. Unfortunately, he went one way, his ankle went the other. He had to retire from the sport because of the injury he sustained. And my report in this particular matter, it was a rugby league matter. So my report that I provided for the lawyers acting for the plaintiff was when and where were the team training? Why were they training under those conditions? What was the training drill trying to accomplish? And then from my own experience from playing sport, I could understand how an injury like that was sustained under those conditions. So unfortunately, the young boy was about to sign a contract for one of the clubs and his career was cut short. Just a couple of final matters I was involved with. One was a player was illegally struck by an opposing player. So he was playing a game of sport, there was a bit of banter, and it got out of hand, and unfortunately, one of the players took it upon himself to act as judge and jury. In that particular matter, I provided a report for the lawyers acting for the plaintiff. So that particular report, including reviewing witness statements, the Sporting Association's policy regarding players, referees, and unfortunately, several players on the opposition, they signed on illegally. So I did question the Sporting Association's protocol regarding how do players sign on, what identification do they need, have they been banned from playing, how would you know if they've been banned? So hopefully that will increase with now technology. They'll have an online system to monitor these people. And then the final matter was an athlete that was injured having to train unsupervised. This is a young girl who I provided a report for the lawyers acting for the plaintiff, whereby she was injured and again had to retire from the sport due to the severity of the injury. In this particular matter, she was about to go on the world tour of a sport. The injury was that severe that she had to give up the sport and now does something else. So the report that we provided for the lawyers in this particular matter included an in-person assessment of the plaintiff in my room, reviewing all the exercises provided by the trainer, the injuries sustained by the plaintiff, reading the doctors and surgeons and other healthcare professionals' reports. And then I provided my recommendations, again, from experience of being with people supervised. And I also recommended how other sports have trainers supervising their athletes. So most sports now have what's called a centre of excellence, where the athletes will gather into an area and train under supervision. This, just a final point on this to conclude, this matter has implications also for persons in government schemes such as iCare, motor vehicle accidents and workers' comp, where the government agencies wants the injured persons to now self-manage their own rehab program and are trying to reduce the amount of supervision that these injured people are receiving. So, Michelle, that concludes my report. Sorry, my talk. I apologise. Thank you.
Rod, that was really very interesting. I guess one of the big takeaways for me was the fact that to use kettlebells in a gym type of training session, that you actually need an additional accreditation or qualification to be able to do that. And it makes me think of the exercise classes I've attended over the years where kettlebells have been part of it. No wonder whether they're accredited to do them.
Mm.
So that was certainly very interesting. I think people need to be, better informed about that. I think of times when I've been in a gym myself, and I've just gone up to a person working there and said, "Hey, can you tell me how to use this piece of equipment, or how much weights should I be putting on here?" And I must confess, it never occurred to me to ask whether the person was actually accredited to answer my question or not.
Mm-hmm.
So very interesting there. Of the people who've attended, do any of you have a question to ask of Rod? No, that's good. Usually means you've answered their questions. I do have a question from, interestingly enough, a lawyer who was unable to attend today. And he put his question to me in an email under the quotes, "Shit happens." And he said, how do you determine, when there is a team, now whether that's a professional team or an amateur team, and there is a trainer who trains the staff, trains the players, supervises the players, is present at their training sessions and their games. But sometimes when a person is running for the ball or whatever they're doing, their foot just does the wrong thing or they trip. How do we determine whether it's just something that happens or whether there is actually a failure on the part of the trainers?
Well, on the matter that, if I go back one slide, excuse me, if I go back one slide, if I can. Oops, I apologise. That's not, there we go. The second one, or the top one, really. Oops. Where the athlete fell into a pothole or collided with another player on a dim lit sports field. We look at, for instance, the surface. We look at the time the incident occurred, where it occurred, what were they doing, and what did they do prior. So if they're training for an hour and a half, then they decide to go and have a full body contact game of sport, players are going to be fatigued.
Yes.
So who decided to design that kind of exercise training regime? Were they playing on a field that was in the middle of winter when it's pitch black at 6 o'clock and there's minimal lighting? So that comes back to the lighting requirements of the playing field.
Mm-hmm.
So we would ask half a dozen various questions to try to drill down a bit to see the conditions, the athlete themselves, whether other athletes are out. And then we'd be able to determine, look, I do agree. There are times when things just do happen. But that's the role of the trainer to obviously minimise that risk. And in our sport of rugby league, at a professional level, from what I gather, and when we played, you had to strap your ankles for every training session and every game. Again, just minimising that risk of twisting or straining your ankle. Mm-hmm. I don't know enough about amateur sport at that level, and lot of them play on artificial turf now. They don't even play on regular grass. So
True.
there's other complications. So we'd have to ask the questions and
Yep.
yeah,
Look at each one on a case by case.
Inspector
Look, one more quick question. We do need to wrap up, but one more quick question here, and it relates back to the rehab situation. So a person has had perhaps a spinal surgery or a significant orthopedic surgery, and what happens there is that they usually get transferred from the hospital where they've had the procedure after a couple of days to ensure they're stable, and they're moved to a residential rehab facility where they're attended on a daily basis by OTs, physios, and other people to support their rehabilitation and return to sort of active movement. Now, oftentimes in these places, the residents are older people, elderly people who've had a hip replacement or a knee replacement. How do we need to manage rehab where the person is actually a fit and young person who was previously very active and is now in a facility with elderly people? How do we ensure that those physios and people supporting rehab and designing the exercise understand the difference of designing rehab for somebody who was previously active and fit with a greater capacity than a 75-year-old person who needs to adjust to a new hip?
That's in your training as a physiologist or a physiotherapist. That's part of our training, is to look at various different people, and we're aware that a 75-year-old person is going to be, obviously may have other medical conditions as well. One of the areas would be also following the surgeon and the doctor's recommendations. A lot of the time the surgeon or the doctor will put a list out saying the person can only stand for 30 seconds or can only walk for 20 metres or can only carry up to 1 kilo, whatever the injury or the post-op information might be. But it's in our training as a professional to know that a 20-year-old person who has, let's say, no other medical problems and has only just had a total knee replacement or an ACL injury or whatever it might be, we're aware of how to rehabilitate those people. That's part of our training.
Fantastic. Look, Rod, this has been really, really informative, and I'm sure very interesting for our clients. I know a lot of people registered to attend this and will be really interested to review it and to see the articles. Thank you for compiling that bank of important articles and information that supports what you've explained to us all. Everyone, thank you for your time joining us today. We look forward to seeing you at our next seminars. And you've got a thank you there in the chat, Rod. So, yeah, so that's great. That's great. Everyone, go and have a lovely rest of the day, and we'll see you again next time. Thank you so much.